Hello again from another episode of the Crotchety Old Men podcast. Hi, I'm Gary Smith, one of the co-hosts, and with me today is our host, George Crumley. Top of the day to you, George. How are you?
Top of the day to you, Smitty. How you doing?
And I'm doing amazing. I'm amazing. Look at me.
You are amazing, Smitty. You are. And so is our topic for today. Our
All
topic
right.
for today is long-term health insurance. And one of the things that may be overlooked, as we get into these golden years of retirement. Back probably about 20 years ago, myself and my wife, we were thinking about, what are we going to do when we, get to that age, as far as, who's going to take care of us if we get sick, if we get an illness that may, well, we may need some help, nursing help. So we started looking into what they call long-term care insurance, which is provided by, at that time, by most insurance companies. But things have changed. And so I thought that would be a great subject to talk about today.
Absolutely, because as you're talking about that planning stage of you and your wife, I'm sitting here thinking, long-term care. I never think about I'm going to need somebody to take care of me as I get older. And I wonder how many other people are feeling the same way. So talk to me, George. What's the importance of long-term care?
Well, the importance of it here again is if someone's going to take you, if you are not able to, do the functions, eat, feed yourself, getting out of bed, go to the bathroom, you're going to need help. So, and, if you have a family member doing it, they're going to have to take off work, especially if you need 24-hour care. Are they going to have to quit their job? Are they going to have to employ someone to come in on a full-time basis to help you with these things? And if any of these occur, how are you going to pay for it?
Wow. So now are we talking long-term care at home, or are we talking about long-term care in case in the hopefully unlikely event that you have to go to a facility of some kind?
Well, that's the interesting thing about it, Smitty, because like I said, about 20 years ago, when they talked about it, they didn't really talk about in-home. Everything was either at a nursing facility or at a assisted living facility.
Hmm.
So times have changed a little bit, and insurance companies have now had to back off of actually selling this product because of the fact that, the numbers don't support the actual policy because not enough people actually purchased the insurance, and then the cost has really escalated for this type of service, with medication. And so with the
Hmm.
premiums that have been collected over years, it's not really supportive. So what you find out is a lot of companies have backed off. And also what we find out is the language in some of these policies. So for example, you may have purchased a policy 20 years ago
Hmm.
thinking that you may want to go to a nursing facility, but because of now when you want to be in your own familiar surroundings, you want in-house care. And that policy may not support that. So you have to really look at the language of what that policy will actually provide you if you did buy one, say 20 years ago.
Shucks, what it's sounding like is that you're going to have to pretty much self-insure for that, meaning you're going to have to put aside some monies for that before you need it. And probably the situation I'm in, because having not even considered it, I don't own any long-term care insurance. So now either you're going to have to pull that money from other resources, or I guess the worst case scenario is that nobody's there to roll you over. That's not a
Well,
funny thing to me.
here again, that's why it was created so that it would not dig deep into your, financial savings that you had put together. So, if, husband and wife, husband gets sick, needs that type of care. If it digs into your savings that your 401k, your IRAs, your Social Security, then it could devastate you financially.
Oh,
And
yeah.
if you pass away, then your wife is, stuck particularly penniless. So that's why the insurance was created from the beginning. But like I said, times have changed, situations have changed. So you have to kind of look at this whole thing differently.
Hmm.
Insurance companies being smart as they are, now they've come out with some hybrid plans that you can now look at, meaning that You can purchase, say, an annuity, which you'll pay in it for maybe the first 10, 15 years. That will go towards long-term care insurance. If you don't use it, you can then turn it over to regular life insurance, which would go to your estate if you passed away. So that's one hybrid program that has kind of come out. So insurance companies, being smart as they are, they come up with alternatives when certain things don't work. But as you said, yeah, if you didn't purchase one of these things 20 years ago, it's something that you really seriously have to look at.
So, in lieu of what you just said, so it sounds like it's important for a person to start thinking long term in their planning. I mean, that's what we do anyway, as we start doing retirement planning and things of that nature. But this is a topic that goes beyond retirement planning. Just like getting life insurance at an earlier age when the premiums are less, it's a good time to start thinking about that long term care while you're healthy. There's a saying that says it goes that you dig your well before you're thirsty. I think this is appropriate for this topic.
Absolutely, absolutely, and that's why I said we started thinking about it about 20 years ago, because of the fact that when you get older, it's like, who's going to take care of us, you
Right.
know, and you don't want it to devastate your savings. These policies have always been pretty costly, so
Mhm.
that's really a decision, like you say, as far from a planning perspective. You really have to make some decisions as far as if this is something that's affordable, um, and if that's something you really want to do.
Man, what a dichotomy that can be for people. Because here it is, I look at myself and I feel great. My all my medical stats are good and all that kind of stuff. But as we both know, there's life changing events that can happen in a blink of an eye. And if you're not prepared for something like this, it could be devastating financially, emotionally, and every other way. So, hopefully, people are tuning in and listening to this, because this is a very serious topic when you think about it. With all the things that's going on in the country today, and all the things that's going on in life, period. One thing that we don't have a guarantee of, and that's good health.
Yeah, it kind of fits in with the disability insurance and those types of things, because if you think about it, if you're in a, unfortunately in a car accident, or a home, fall off a ladder, any type of accident, and you're critically impaired for the
Mm-hmm.
remainder of your life, here again, you're going to need some type of care.
Oh
So it's
yeah,
something you really need to think about. How are you going to survive? Who's going to take care of you? So it's something that you really, really need to look at. And it's not for everybody, but I thought it was a good point that we should bring up on the podcast to get people thinking about. It's just something that's available. These hybrid programs are probably more flexible for today's generation. So those are something that you really want to, talk to an insurance agent about.
yeah. And interesting enough, we're talking about long term care, but don't get it twisted. A young person can need long term care. Okay,
Absolutely.
you've been to a lot of facilities where you see people much younger than us in wheelchairs or whatever. Life events again, like I said, and so it's something that you don't. You're not just planning for when you get old. Long term care is something that should be considered in your planning, financial planning. Let's put it like that. I'm so accustomed to saying retirement planning, but let's take the word retirement out, because in the blink of an eye, any of us could need that long term care.
Yeah. You can't insure yourself for everything, but you at least need to look at it. And depending on your age, if it's affordable, it's something you may want to consider.
Yeah, that's the key word right there, affordability.
Absolutely. Yeah, absolutely. So here again, we just wanted to give you our audience something to really kind of chew on. Here again, that's what the Crotchety Old Man podcast is all about. It's trying to keep you informed as to what's going on financially, health wise, and something that can really help you in your day to day walk in life. So, Smitty, with that said, what you got to take us home with?
Well, I got a quote from one of my favorite authors, John C. Maxwell, and it goes
Okay.
like this: your success stops where your character stops. You can never rise above the limitations of your character.
There you go. Hey, well said. And as we always say on the Crotchety Old Man, if you
If you
didn't
did,
know,
now you know.
now you know. Take care.
Ah,
Peace. Be blessed.
peace.